Here's to your health, brought to you by Coliseum Health System. A major advance in healthcare is robotic surgery. With more on the procedure, here's Director of Robotic Surgery, Dr. COLSCNR52-40LVRobotSurgAtalah4.
Started by NASA, and they were the first one who are thinking about if they having our sons and daughters in the outer space, and they got sick, how can they deal with emergency? So they were thinking about sending a robot in the outer space where if anybody gets sick, they can perform a surgery remotely from the Earth, let's say from a different state. And then it got bought, the idea, by a private company, and it got manufactured and starts to be under kind of investigation until it got an FDA approved. And the first cases, as far as I remember, it starts in early 1990s. And it was first started with urological cases, mainly for prostatectomy. And it was mainly used for cancer prostate. Nowadays, things changed. So we not do only malignancies, but we do benign condition as well for multiple specialties, such as urology, gynecology, colorectal, cardiovascular, and so on.
What exactly takes place during robotic surgery?
We have a very small, tiny incision, and we introduce what's called a trocar into the belly button, and there is a camera attached to the trocar, and the camera is illustrated here. It goes inside of the patient's abdominal cavity after we insufflate it with carbon dioxide, and then we have robotic arms connected to another trocar, which is 8 millimeter, where we have instruments get control from what's called a console. So the actual physician is not sitting next to the robot, he's sitting in the corner of the room, performing it remotely from a different area. And if you look at, in comparison, these instruments are so small in comparison to the dime, and it's really fascinating.
How does robotic surgery compare with traditional laparoscopic surgery?
In robotic surgery, we call it an endo-wrist movement, meaning that small instrument, it's moved by the thumb and index finger of the surgeon, and it can move in 360-degree free mobility. So if we look at that scissor, for example, if I open it here and I bend it, look at the mobility. While in laparoscopic surgery, we are losing this mobility. We only have a mobility of the wrist, which if you look at this instrument, this is the grasper. If I want to move this grasper, the surgeon has to be next to the patient and has to control it. And he or she will have a very limited mobility. It only moves right to left, up or down. Versus in robotic, you have the 360-degree free movement in all direction, and this is gives it what's called precision. You go and you do your job very clean, very precise, without blood loss, and it's amazing.
Robotic surgery is being put into use in a number of different procedures.
We have actually, if we divide it with specialty, we have the urologist, and they are doing prostatectomy for cancers. They're doing some benign condition, which calls for renal cell, I would say benign tumor. They do what's called partial nephrectomy, meaning removing part of the kidney using the assistance of the robot. Some of them they do nephrectomies, which removing the entire kidney through the robotic help or robotic assistance. And then if we jump to gynecological procedure, they do from hysterectomies, myomectomies, and lymph node dissection for ovarian cancer or endometrial cancer as well. If we go to colorectal, which is really very, very new to the robotic procedure in general, we have Dr. Brewer here. He's doing anterior resection of rectosigmoid colon and cancer colon, which is really amazing.
As robotic surgery is used more and more, the advantages to the patient become obvious.
Less blood loss, less hospital stay, less pain, recovery. I will say in the old days, if a patient goes for an open procedure, they usually stay in the hospital for 3 or 4 days. After robotic surgery, next day they're out and they feel good and they want to go back to work.
Thank you for watching Here's to Your Health, brought to you by Coliseum Health System.